Howdy, I'm Dr. Robin Murphy, and this is a repeat of a talk I gave for the International Federation, the Red Cross and Red Crescent for their Solferino Academy. And what I'm talking about is a guide to using robots for pandemics and reviewing lessons learned from 338 documented uses in 48 countries and how robots were used to cope with COVID-19. I'd like to give a big debt of acknowledgement to Rick Schofield from the American Red Cross, who is forwarding this work, and also to my collaborators who have worked on the NSF study for the analysis, Dr. Angela Clendenin from the School of Public Health, Dr. Jason Motes from the Engineering Extension Service, which is our big emergency management group, and our students, Vignesh Gandudi and Tricia Adams, and the president of the Center for Robot-Assisted Search and Rescue, Justin Adams. So when the COVID pandemic happened, we saw a lot of questions along the lines of where are those robots? And the short answer is, turns out they were everywhere and in every possible use, I think, came out. But when you think of robots for a pandemic, you probably think of something just utterly creepy and scary and science fiction-y, and that is not what they look like at all. So we're going to go through that. And our objectives is to talk about what can robots do, especially for public health related tasks during a pandemic, and also how you can think through whether a robot is going to help you work safer and smarter, not harder, and to reduce human suffering. I want to tell you a little bit about me so you know where I'm coming from. I am a professor of computer science and engineering at Texas A&M, but I'm also an emergency responder. I tell people that through CRASAR, through the Center for Robot Assisted Search and Rescue, I've been to 29 disasters, not of my own making. I think in terms of pandemics, it's useful to note that I co-hosted a White House and NSF workshops during the 2014-2016 Ebola crisis, and I am chair of the Robotics for Infectious Disease.org consortium. In Texas A&M, you may not be familiar with Texas A&M. It's about 2 hours from College Station's about 2 hours from Houston. We're third in engineering research. We're just behind MIT and Georgia Tech, and we're one of the largest universities and one of the largest engineering universities in the world. But what makes Texas A&M really special is that it has been a leader in disaster practice, training emergency managers, all types of responders since 1929, and we actually are the Texas Department of Emergency Management. Now, this is a study, these results is a study that we conducted for the National Science Foundation, starting back in March and going through January 23rd, 2021, because the first instance we found reported turned out to be January 24th to 2020, so we did a 1-year look. And most of this will be coming from social media and scientific papers, not a lot of scientific papers because it takes a while to get those through the pipeline. But it's also good to know that the words robot and COVID-19 show up pretty much in any language, and we could work back from there and get translations. So we found overall 338 instances in 48 countries over a 12-month period, looking at when their dates that we could ascertain was actually put into use. And you can see it spans all 6 continents. If we look at this by country, you can see the top countries by number of robot instances. And that's not the number of robots. Like if they had 15 robots doing a particular task in a hospital, that we called that one instance. But if you look at the number of instances, the United States led, then China, then India, Great Britain, Italy, South Korea, Spain, Singapore, and then it drops off pretty quickly. Now, if you look at the date of the first reported use, you can see that the United States was the first to use it. There was a Seattle hospital. They got a very suspicious very odd illness. They decided to treat it like SARS or MERS or Ebola, and they sent in a telepresence robot so that they could work remotely while they tried to figure out what was going on. If you look at these 8 countries in yellow, you can see that these were countries that had some sort of use of robots before the WHO declared a pandemic on March 11th. So they were a little ahead of the curve. All right, that gives some background. What can robots do, especially for public health related tasks? And the answer is probably everything. But let's work through what robots were used for first. And it turns out the number one use was not for clinical care, but for public safety enforcement of public health. One was, the largest one was for quarantine enforcement, and particularly using unmanned aerial vehicles or ground vehicles to see if people were violating gathering or were out and about when they weren't supposed to be. Another big one is disinfecting public spaces. So you see that big over there, the top of that lower image, that's a quadcopter. It's a rotorcraft. It's designed for agriculture, for precision agriculture, to precisely spray fertilizer and pesticides, very localized areas. So this was easy to adapt for disinfectant to disinfect public spaces, public benches, bus stops, and subways. We also saw a little bit of using drones to try ground robots and drones to try to identify affected people using thermal imagery. Public service announcements flying over people asking them to diverse, marine vehicle to ask them to disperse, kiosk, kind of mobile where you'd normally have a kiosk, instead going through there and kind of rolling up to people and letting them get information about COVID, and monitoring traffic flow. Clinical care. And I know these terms are all problematic. Think of clinical care of everything that you would do in a hospital or a clinic. Okay. The number one was disinfecting the point of care, using these UVC light robots. That was the primary means of using robots there. The second largest was observational telepresence. That's basically, an iPad tablet on wheels, and allowing the healthcare workers to talk and speak and hear without having to enter the room and being the direct presence, so it reduced their exposure. We also saw a large amount of delivery and inventory robots. We've had robots delivering meals in hospitals for a long time and delivering medicines also, and that sort of thing. We did see a little bit of what we call interventional telepresence, particularly in Asia, where interventional is where the robot actually touched a person. So with observational telepresence, you can roll in, you can ask them to take their temperature and read off the recording. You can ask them to take the nose swab and make sure they do it, but you'd never touch them. So these are robots that were doing ultrasound scans, or actually doing robot nose swabs or mouth swabs. So they were really more experimental. We'll talk a little bit more about that later. Another wonderful humane use of robots is to allow the patients and families to socialize. So it's not just using the tablet on wheels for the doctors and healthcare workers, it's for the families too. And some hospitals actually were as concerned for their healthcare workers as the people in the waiting room. And so their receptionists were working remotely through these types of robots as well. The third largest use, and this was a surprise to us as roboticists because we hadn't seen this before, there was a very large adoption of robots to enable the continuity of work in education. Number one use was take those sanitation robots and start cleaning workplaces and schools, but we also saw telepresence for learning and interacting. We did see an increase of robotics in warehouse and process automation. Workers were ill, and we saw a huge growth in e-commerce. So the only way to scale to handle the surge or to compensate for those workers was to look at using robots. We also saw operational surveillance and private security. Those are two ways of basically your facility is shut down, but you want to run security, so you have security robots. And we saw some interesting work of uses for construction and agriculture to help that continue. The fourth largest use was for medical laboratory and supply chain automation. And in particular, we saw a lot of work with delivery of samples, to be tested for COVID, as well as reagents and other things. So these are very small loads taken by very small UAVs. One thing that's true, turns out throughout the world, these laboratories are not next to the hospitals. They're usually off at the outskirts of town in an industrial warehouse district. And so being able to zip right over to them really sped up the process. Likewise, robots were there to handle infectious materials, both in the hospital and try to reduce the amount of exposure to it. We also saw robots that manufactured PPE, automated that, or automated deconning them, like zip, zip, zip with lasers to clean them. And then, of course, laboratory automation, increasing that because it's very hard to get technicians who are trained and authorized to do this. Fifth largest was quality of life. Again, another surprise, because things like delivery of food, non-food purchases with these small ground robots and even with aerial robots had been kind of like, no, I think I'll pass. So regular people weren't using it. There was a lot of resistance. And after this, it was like, no, that's great. Now, it is easier when nobody's around. Okay, so that is you didn't have to worry about sidewalks and things like this. But this turned out to be a lifesaver for several neighborhoods where they had very stringent lockdown rules. Some fun uses of robots: attending public social events like this graduation, interpersonal socializing. I mean, my favorite of that is a man took his drone to a woman he had met before the lockdown, flew it over to her apartment, and asked her to go out on a date with him as soon as the lockdown was going to be over. So that was cute. And there's all sorts of other personal activities and social events that people were using robots for. The sixth largest, the last area, was for non-hospital care, which we mostly see, think of that as your quarantine camps or hotels, or we're seeing the assisted living and nursing homes. And so we saw a large number of robots, the same meal delivery robots for hospitals, be adapted to use in a hotel or a quarantine camp. So here's a robot that goes, it beeps when it gets to the door. It's pre-programmed to know where the doors are. Person comes out, gets their tray. Then it goes to the next door, beeps. That person comes out, gets their tray, and so on. Quarantine socializing, particularly with those in nursing homes or assisted living, what a great use of robots. And also telemedicine, that public health surveillance, using those robots to help healthcare workers work remotely and be able to cover more people. Big lesson is that we're not replacing people. I mean, when you see in public safety, it's all about enforcing public health policy. For clinical care, it's about protecting the healthcare workers and handling that surge, being able to delegate things like cleaning rooms, taking out the trash, taking out the contaminated trash. And by the way, these robots, the majority of them can be easily decontaminated. Continuity of work and education, about protecting the workers and the customers and the students, about compensating for sick workers and handling the surge in demand for online orders. Quality of life was about enabling routine life to go on during a lockdown. The laboratory and supply chain automation, again, handling the surge. And then non-hospital care was like quality of life. It's enabling routine life to come on even if you're in a nursing home or a quarantine camp. Another interesting thing was it wasn't sequential. You didn't see, okay, first there were the clinical care robots because everybody knew the healthcare workers were at risk. And then, oh, we've got to enforce the public safety lockdowns. And then the something else, quality of life robots. And then, oh, we really need, nope. It was from the beginning, all the different uses of robots. You can look to see that within 1 month of the Declaration of Independence, by the end of March, there were significant reports, notable reports in each of those 6 work domains, those 6 categories of socio-technological work. Another thing is that let's look at robots. We're going to use brown for ground vehicles, brown for dirt, for ground, blue for unmanned aerial systems or drone, blue for sky, and gold for unmanned marine vehicles. And you can see there were a lot, of unmanned aerial vehicles, of drones, even though, of course, the majority were ground robots. And you did have 2 robot boats. One was used by lifeguards to help disperse people that were kind of like going off the beach, and then we'll just gather in the water in large groups. No. And check out oil rigs. But the rest of them, you saw things like the aerial systems for the public safety for spraying, and for the laboratory and supply chain automation for delivery of reagents. So those were big, big uses. And indeed, the top cross-cutting uses of robots across all those 6 categories was some form of disinfection, some form of sanitizing an area, using robots for that. And that's kind of great because it's both helping make that safer for people, but it's not handling the surge, and it's not exposing the janitorial staff to this. Delivery, some form of delivery. Now that was a lot of delivery, and we think that was a breakthrough. Part of this is that it is easier to fly. It is when there's nobody around, and it's easier to drive on sidewalks and stuff when there's nobody around. Everyone's in lockdown. But we learned a lot of good lessons there. Telehealth was third. You saw it was a very, very useful technique for clinical care in there. All right, now, how do you think through getting a robot? How do you know it's actually going to help you and do the right thing? So let's walk through that. But first, that's a really big question. So let's break it down a bit. So I'm going to tell you a little bit about how do robots work? How do you know a robot will work? And how it will work for you? Should you use a robot? Because there are some concerns for some applications. And how do you know if a robot already exists? So how do robots work? Well, there's really 2 ways they work. And one way they work is they're autonomous. Okay, autonomous, it doesn't mean ex machina, a humanoid robot that's as smart as we are. It means something that's good at one thing. It's like a Roomba. It's good at one thing, and you're delegating that one task or specific thing. If something goes wrong, you can go fix it yourself, get it unstuck, that sort of thing. So this is not as exciting, but it is useful. It's not what we think of artificial general intelligence. The other way of thinking about it is teleoperated, where the person is driving the robot and they're hearing and speaking through the robot. We'll call that often remote presence because we're allowing the person to project themselves remotely into whatever area that robot's in. Both of these are considered artificial intelligence, just different types and different degrees and styles of intelligence. So we kind of go a little crazy when we say, oh, well, autonomy is artificial intelligence is the only way to do it. It's like, oh, not really. Now, if we look at the top cross-cutting uses of robots, we see that for disinfection robots, they were autonomous for clinical care. You had the cleaning robots. Some of them, like the ones made in Denmark, will roll into the room, roll around and clean. Others, and then go to the next room on the list, just all by itself. Others, a person rolls it in and then leaves in 45 minutes, comes back. But if we're looking at teleoperation outdoors with drones, that was, for public safety, that was teleoperation because the public safety officials needed to take that drone and spray, make sure they were spraying in all the right places and we're in control in case a pedestrian or somebody walked in. So you could have it either way. Delivery was autonomous. Okay, it's autonomous. You push a button and it does what it's supposed to do. But remember, for drone delivery, in ground delivery, there was no traffic, there was no pedestrians on the sidewalks, there was no manned air traffic, and the urban areas were largely deserted. So one of the holdups is that you're taking with delivery of medical supplies is that you want to be sure if you're taking contaminated samples, you don't crash and contaminate, people in an entire city block. But with everybody in lockdown, this was easier, and so it became more flexible to use these methods. For telehealth, we saw, of course, that's teleoperation because it's all about being able to work remotely and project yourself. You're not trying to replace the nurse or the doctor. You're just trying to not get sick yourself. So again, the point here is that the type of artificial intelligence that you want for an application depends on the application. It's not I want the most autonomous robot I can get sort of situation. All right, so you now know how robots work, autonomous teleoperation. How do you know a robot will work? Well, NASA's done a lot of thinking about that. How do you know something that worked for Apollo will work for the space station? How do you know something for the space station will work for the Mars missions? And so they've looked at that, and they've come up with a way they call the technical readiness assessment. And that technical readiness assessment, they have a very formal procedure, so I'm rewording this slightly, basically looks at the suitability of the technology and the risk of that technology. So suitability are things like, is the hardware and software mature? And they have a formal rating, the technical readiness levels. Is it basically TRL 9 is basically equivalent? Is it commercially available and everybody uses it? A lot of people use it. It's not just some prototype. Is it basically the same task and mission? Are there any changes? Does it fit existing work processes? What's the usability of it? And then the risk, the low potential of failures or unintended consequences. And then they break the technology. It falls into one or three categories. A new technology is one that's not mature, that's being used for a very different task, that since it's new in a different task, it won't fit existing work processes because work processes always have to adapt. Remember, when we got computers, that changed everything. When we started using cell phone apps, that changed everything. So it does change, right? And so there's a high risk of failure. So there's a high risk that you're going to add workload. Now the better case is heritage robots, or what we'd say commercially available robots. They already exist, and now you're using them for basically the same thing. And because they've already been used, you already know what work processes and any of the hidden cost, and therefore they have low risk. That one in the middle is an engineering. It's a tweak to a heritage system. Yeah, you're doing something to it. You're trying it in a slightly different way. And so you got to watch it a little bit because you don't know exactly if there's going to be anything unexpected happen. Spoiler alert, you will always pick ones from this category. Always go for the heritage robot. Always go for the heritage robot. And there are many heritage robots in all of the 6 categories that we had talked about. All right, let's talk a little bit more about suitability. That whole phrase, fits existing work processes. What does that mean? Well, one thing it means is that are there hidden workload demands? I mean, what if you open the box to a Roomba? Yay, we're going to get a robot vacuum cleaner. We're going to be able to delegate it. It's fully autonomous. Oh, it takes 40 hours of training before you can use it. Huh? Well, that wouldn't be very useful, right? I mean, probably wouldn't. That's just too much training time. And then you start thinking about a robot that take 40 hours of training during a disaster, a pandemic. Who's got that time? Right? Then we've got the ease of use issue. So sure, there's not a lot of training, you can use it, but it's not easy to use. So we had cases of some most teleoperated robots are like a horse. They have a little bit of intelligence. You don't tell a horse, hoof up, hoof down, hoof up, hoof down. don't hit the tree. The horse is smart enough to do that. You're basically giving it a direction and a speed you want to go at. Well, some robots are, their teleoperations more primitive. And in those cases, we had reports of nurses, complaining about they were hitting the beds, they were getting the robot stuck under the wheels of the bed and that sort of thing. So that's increasing their workload, and whether the cost benefit, the extra work versus the safety is worth it. That's one of those trade-offs that's kind of your job to figure out. Are there hidden infrastructure needs? A lot of times, what is it that it's going to require in wireless? How much electricity, power pattern does it take? Is it assuming you've got an IT personnel who's going to fix any problems? I mean, after all, don't really think of IT personnel in a hospital or at a quarantine camp as having loads of extra time, that they're just looking for things to do. So that could be increasing your workload or increasing your workforce to handle it. Again, may be worth it, but you'd want to know about it and plan for it in advance. Now, a great example of this is the Ebola outbreak, the 2014-2016 outbreak. And roboticists, I was part of the White House. I did 2 workshops, one for the White House and one for the National Science Foundation on this. And these were the types of robots we as roboticists were so excited about. Oh, we'll take this prototype robot, Baxter, from a startup company from MIT, and the number one problem is all these workers are getting affected because they're taking off their PPE incorrectly. We'll take it off for them. Yeah, okay. Well, there's all sorts of fits existing working process, besides the fact that just training them to take their PPE off is a fast and efficient way. If you try to take that robot there, you're taking it to West Africa, where the rural villages, subsistence villages, where there's only electrical generators. There's whatever wireless internet that somebody like the Doctors Without Borders have set up. The roboticists will not have that access to that, and they'll take up every ounce of it. So that's not good. Dirt floors with ramps and standing on wood pallets. That's not great for robot wheels. Okay, and think about the logistics. Handling the feeding and housing roboticists in their gear. And it's a mismatch for cultures. Why would you have this kind of strange, creepy, human-looking robot with people who may have never even seen a cell phone? It seems almost cruel, as Dr. Andrew Natsios from USAID pointed out to us rather forcefully, that we were kind of missing this whole social dimension when we apply robots. Now, on the other hand, Ebola was interesting because we have basically the same task and mission. And let's look at that. So you may recall during the Ebola, we did have an outbreak in Dallas, Texas at a hospital, managed to shut down a whole ward of a hospital, take out 2 ambulances, just, decontamination. What a mess. And as a result, the very first disinfectant robot was created. Well, look at those wheels. That's the Xenex robot. That's not particularly good for Ebola in West Africa. And by the time they did it and got it there, Ebola wasn't happening in urban areas. It was very well contained. But boy, that had this great use for a similar task, which is disinfecting in general. And since hospital-acquired infections are such a problem, found a market for that. And in fact, it was such a big market that by 2020, it's common use in many hospitals. There are multiple vendors of this, Xenex and UVD are the 2 big ones. And so these are heritage robots now as a result. And so will it work for cleaning COVID? Sure, because it's identical to a hospital-acquired infection for all practical purposes. And it's not that you should take heritage robots if you can get them. It's that you really have heritage robots, okay? We found at least 67 models of commercially available robots spanning all 6 categories. Every category, you had a commercially available robot. It may not have been perfect, but it was there. And the users did choose heritage robots, 78% of the time of that. Now notice that those pink and salmon colored curves never go up. These are cumulative over the epi curves. cumulative use of the robots over the epi-curves. And what that means is that we didn't get a lot of building robots just for the pandemic. We saw that initially in the first month, but we didn't see any more come on, which you would have thought, oh, now we're beginning to figure out it takes about 8 months to get a new robot mocked up in there. No, we didn't really see it because once they mocked up the robot, most of the companies realized there were already heritage robots out there, that they were coming late to the table for developing new technology. All right, so robots work. You know how the robots work. You know they will work, and how to evaluate whether a robot will work for you. Should you use a robot? So that gets an interesting question of ethics, culture and ethics. We talked a little bit about cultural concerns. Let's talk a little bit more about ethical concerns. So, and this is, you know, when you start looking at by different countries, but what you see overall is that people were scared about the loss of privacy with drone surveillance in particular. There's always the fear of job replacement with that. But look at this. People were worried about, did the robots really work? Were they violating regulations? Were they being used safely and correctly? Whoa, they should be regulated. They're not being used in a way that we think is good. That unwarranted surveillance, back to privacy. You're using robots in a very aggressive way. Why? We don't see the need for that. And then professional ethics. This is interesting. Professional ethics, we saw a lot of cloning of robots, particularly the UVC disinfecting robots. So those were around. They're kind of expensive, and pretty much within 1 month, all their inventory was accounted for, and they were rapidly making more. But if you're a country and you look at that, in some countries like India, said, oh, well, they're too expensive, the wait time is too long, we will build our own. Well, there are two problems with that cloning. First one is that it turns out it's not just getting the same light bulbs. There's all these reflectors, there's timing, all the things that show that with these FDA, these proven claims of effectiveness that have been demonstrated, all of that goes out the window because you're not testing it the same way. You're not even taking advantage of that. You're also violating intellectual property. And so that's intellectual property rights. And that's something, particularly in the United States, that a lot of technology won't be adopted because it's not clear. Oh, it's open source. Or no, we just show that you're not infringing on somebody else's design because we don't want to get sued later. But we do see that. And so that idea of cloning, the idea it may not work. The unproven claims of effectiveness was interesting. Several people quickly noted that this use of thermal imagery to check on people has never been supported in the literature. That's very noisy, very high error rate, and yet, oh yeah, we're doing it. Now let's get back to social concerns. Now you're sick, you're older, you're disoriented. Oh my gosh, how are you going to react to these robots? So Spot Mini, wonderful robot, a great intellectual achievement, but it looks like something Sid from Toy Story would put together, right? It's very creepy. And then think if you're sick, you're in a hospital, you can't move, and in is wheeled this cart without a person, and this arm whips out in like a bad science fiction movie. You're told to be still while it does an ultrasound. I'm pretty sure that my dad would have said, no, hell no. And if he was at all possible to get out of that bed, he would have gotten out. So we need to think about that, more pragmatically. All right, so, and then you think of some robot like this. Doesn't that look nice and cute? Well, actually, no, that didn't work any better. They tried these more anthropomorphic, childlike robots, which should be friendly, and in Italy, and the seniors reacted very negatively. They were, why are you doing this? Why don't I get a real doctor? This is creepy, all this stuff, So they wound up, the healthcare workers wound up spending a lot of time explain, no, we're going to talk through this. We're going to do things. This is protecting us and keeping us from being sick. We're still paying attention to you. We still love you. No, we're really still here. But in retrospect, we could have seen that coming. So how do you know if a robot already exists? We've talked about these heritage robots. We've talked about work processes. How do you know they exist? Well, one way is to check in with a country that has a national robotics policy, because these are the ones that had robots in all the categories. And robots with a national robotics policy or some type of initiative are China, the European Union, Germany, Japan, South Korea, and the US. And you can see that Germany is also part of the European Union, but they have a special one. So if you look at those, you see that those did quite well. They were in the top 8. The majority were in the top 8. But another way is to contact me, and I sit on boards in Japan and in the European Union. I'm pretty familiar with what's being done. We can connect you to national academies and all of that. We can reach out and get you where you need to be. All right, so let's put it all together. Here's the first lesson. There's no need to recreate the wheel. There's a wide range of commercially available, reliable ground and aerial robots. They exist and they work. The best approach is to clearly understand what you need a robot to do. What are you looking for? And then, when you find one of those robots that exist, be sure to ask the tough questions about those hidden costs, because there's always hidden costs. What is that cost benefit, and is it going to work for you? And the third one is probably the most important. I mean, we're in the middle of a pandemic, actually coming out of it. So don't wait for a disaster to engage and partner with technologists. Start reaching out and partnering with them now so that you can shape the robots that you want. And, even though the robots exist, they're not perfect. They're not exactly what you need. They could be better, and they're not going to get better without your feedback. And you're not going to know what's possible if you're not working with a technologist. So please, let's work together. Anything that I can do, the Robotics for Infectious Diseases Consortium, or the Center for Robotic Assisted Search and Rescue, please let us know.